major highlights was the large core AVT trials, for sure. SUN3 was a big highlight. Again, neutral trial, but it's the first trial using colchicine in stroke. Looking forward to see the results of the other two trials. Of course, the NA1 trials, the ESCAPE, NEXT, and Frontiers are very interesting results, but they triggered a lot of discussion, both inside the room, but also outside of the room. Everybody was keep talking about that, why the one is neutral and the other one is positive, what's going on, what are the next steps. So I would say that, these are the major trials for the plenary session. Some interesting also stuff going on in the other sessions. There was a study from China using stenting in ICAT patients after failed EVT, which, although it was small numbers, there was some concern about safety issues. So a lot of interesting stuff going on, and I think after the conference, we all discussed with our colleagues how we will implement these results into clinical practice, and which could be the next steps in terms of research. Well, ANNEXA-I was a study that used Andexanet Alfa in patients with brain bleed that they were on treatment with factor Xa inhibitors. So the trial stopped prematurely because of overwhelming efficacy in the primary endpoint. So the primary endpoint was, in plain words, the expansion of the hematoma. So it seems that Andexanet Alfa in those patients with brain bleeds under factor Xa inhibitors, when they get Andexanet Alfa, the chances of hematoma expanding are much less than the ones that they're getting other standard of care. So this is an important step. It is a practice-changing trial, and again, we're going to see, how these results are going to be implemented into clinical practice.